The following story you're about to see is about a girl suffering from adjustment disorder. Adjustment disorder is found in all cultures and in all age groups. The presence of a causal stressor is essential before a diagnosis of adjustment disorder can be made, while the symptoms vary and include those that are found in other common psychiatric disorders. The stressor can be a variety of different things that trigger an uncomfortable response to the environment. A single event or even multiple events can bring about this disorder, leading one to feel much more distressed than average. Some common examples are going to college, unemployment, moving, loss of a loved one, and marital problems. Adjustment disorder also consists of different subtypes, which include depressed mood, anxiety, and disturbance of conduct. According to the DSM-5, adjustment disorder is also part of the same diagnostic category as PTSD and acute stress disorder. Symptoms must begin within 3 months of the onset of the stressor in order for diagnosis to be given. Many times patients feel helpless and cannot seem to really enjoy many positive things because the emotional causes of the stressor are constantly on their mind. When the stressor starts to disappear, or the person is able to adapt to the new environment, the symptoms start to lessen. If our emotional reaction exceeds an expected response, or our ability to function is impaired, for example, avoidance of social interactions, difficulty getting out of bed, or falling behind in schoolwork, then a diagnosis of adjustment disorder may be indicated. Not all individuals undergo similar stressful situations in the same way. Each individual has their own coping method. Individuals have different vulnerability to adjustment disorder depending on their personal background. Causal factors include someone with high neuroticism and low extroversion. Having higher education level is a protective factor, since higher education often protects against psychological distress. A daily routine such as cooking yourself a meal can become so stressful that it becomes a trigger.
Hey, Michelle, do you want to go grab lunch or something?
No, I have too much work to do.
Dude, why don't you ever want to hang out?
I don't want to get behind or anything.
You keep, missing out on all the stuff we're doing.
I'm sorry, I don't have time. I'm sorry.
After numerous nights of tossing and turning, Vushwa decided it was time to get help. Thankfully, her school, Cal Poly, offered free psych services at the health center. She went immediately.
Alright, Vishwa, why did you come to see me today?
So I'm pretty new to college, and I just really miss my parents, and recently my boyfriend just broke up with me, and I don't know, I'm just stressed, and I don't have an appetite, and I just feel like, I don't feel like doing anything, and I can't make any friends because I'm not motivated to socialize with them. I don't know what's going on.
It sounds like you're having a little bit of trouble coping with some of these new experiences in your life.
Yeah, everything, like all the old is gone and everything is new, and it's just hard because it's too many things at once and I can't deal with it right now.
Okay, well, it seems like you're experiencing some of the symptoms of adjustment disorder. And it's something we can definitely work on, and I think therapy would actually really help you. So why don't we start now?
Adjustment disorder is a relatively short-term difficulty that is the result of one or more stressors, rarely going beyond 6 months. This suggests a solution-focused therapy that helps the individual deal more effectively with the specific life problem, like interpersonal psychotherapy or problem-solving therapy. The goal of the therapy is to help the patient develop better coping skills and also to give the patient an outlet for expressing his or her feelings. The outcome of psychotherapy is overall highly successful, with most symptoms improving within 6 months. Medication is only prescribed for severe cases. This is great news, because that means you can get back to living your life again.
Did you guys see that lady in the UU, the crazy Christian Southern lady preaching?
Oh yeah,
She was so crazy.
Yeah, she was so weird. She was like screaming and yelling at everyone.
Hey, aren't you in our abnormal psych class?
Yeah, I am.
When are you like familiar?
Yeah, I really like your hat.
Oh, thank you.
It's really pretty.
Do you want to come sit with us?
Yeah, sure. What are you guys up to today?
Oh, we're just talking about the abnormal psych assignment.
Oh yeah, it's pretty interesting. I like it.
I've been walking in the same way as I did, and missing out the cracks in the pavement, and tutting my heel and strutting my feet. Is there anything I can do for you, dear? Is there anyone I could call? No, and thank you, please, madame. I ain't lost, just wondering. Round my hometown, maybe